Hey doc, how do you evaluate your doctor?
Wow, I didn't have to study for this one, Jake. There was no studying for this question. How do you evaluate your doctor? Common sense, I guess. Doctor, what kind of doctor? We're talking primary care doctor, which I used to be for since 2002 to 2005. I was a internal medicine resident at University of Connecticut for 100 hours a week. About that was before the restrictions were in, so I had to work around the clock. Which, of course, I look back on it now, and I'm glad I did. I learned a lot, and I always felt like I knew nothing. So it's funny. And then I became an internal medicine doctor and a primary care doctor, a specialist, if you will, in primary care. So if you're talking about primary care, if you evaluate that doctor, number one, you should look for the resume. Look for the doctor's CV. It should be board certified in primary care, which is either general internal medicine or family medicine. But you might not be able to get a doctor because the way the politics is changed, Jake, and don't need to go into that. Anyone who's been around for the last 10 to 15 years knows that things are changed. It is what it is. Doctors, you're not going to have your own doctor anymore. You're just not. And if you do, you're very lucky.
Hey guys, quick pause here. If you're watching this video, odds are you're concerned about your testosterone levels. That's where the sponsor of this video comes in. Let'sGetChecked.com. Let's Get Checked makes professional health testing easy by letting you get tested without having to visit a healthcare provider. Choose your test online, like one of their testosterone panels, and it will be delivered to you in discreet packaging with next day delivery. Once your sample arrives in a laboratory, confidential results will be available from your secure online account within 2 to 5 days. See my link in the description for more details and discount code.
You're not going to have your own doctor anymore. You're just not. And if you do, you're very lucky. Be nice. Give the doctor some wine or something, or give him some flowers or so, or give him some coffee, or give him something nice. Because if you really have a good doctor, a real doctor, you're in luck. That doctor's stressed. So be nice to that doctor. They have so much work to do now, and they're seeing so many more patients. So when you evaluate that doctor, I guess be kind. Good luck finding a board certified internist. Good luck finding a family medicine doctor, board certified. You may have to get a nurse practitioner. It is what it is. So look for an experienced one. Look for what if you can, their strengths are, what their certifications are. Are they on staff at a medical university like me? So I'm a clinical instructor at University of Connecticut School of Medicine. It's not easy to maintain. It's not easy to achieve that status. It's a privilege to be on staff as a clinical academic. Okay, and in the old day, every doctor was, and then over time they have no time to, and they had to take my day job or work in the med school. I've been fortunate to be able to do both. So, and it's challenging to do it, and it maintains a standard of care that you're going to be evidence-based, and you're going to keep yourself to a high level of understanding where the research is and how primary care or whatever you do to maintain that board certification. So, and then after the resume, or you will, or the CV and the standards of formality, who are they? Or do you like them? There has to be a chemistry. If you're talking primary care, there has to be chemistry. That's why I gravitated to men, and I've done what I've done, is because I just could let my hair down with men, and because of the sexual issues, and because man, and over time, I realized that men needed a specialized doctor. So this is just something that you have to go get a feel for. So after you evaluate the CV and the real structural education and the board certification, are they on staff? What's going on with you and your chemistry with this doctor? Are you getting along with the doctor? What hours do they work? Are they there? Are they going to be there? How do you access them? Can you call them? Can you email them? Do they have a nurse practitioner? I'm on a roll now. So that's it. And be, understand that there's different levels. If you go to a concierge doctor, I was a concierge doctor. I was one of the first, if not the first, with another doctor or two in Connecticut, 2005, where you get your own, you have more time. They pay a different membership or a retainer. It's not a lot of money, but for people that really don't have money and that are lower social economic, they obviously are not going to afford this. It's too bad. It's kind of like, going to a country club. So, I mean, it's just, we're buying a beautiful house or a nicer house. So you can afford that. You should go for a doctor like that if you can, especially if you have medical issues. If you have chronic medical issues or you're older, you're going to need that. So that's really a beautiful thing. So you could ask to see if you can have a special program where you can have more access to the doctor. It's called concierge medicine.